Namaskar, I welcome you all to Nav Shikhar channel of RCI New Delhi. आकाश की बुलंदियों को चूमते हुए बच्चे कुछ अपनी ही मस्ती में झूमते हुए क्यों हो जाते हैं ऑटिज्म का शिकार? क्या सही खान पान और मेडिकेशन से हो सकता है इनका इलाज संभव? जी हाँ, today our topic of discussion is diet and medication in autism spectrum disorder. And today our guest is Dr. Arun Mukherjee. He is a senior consultant in internal medicine and director of UDAN. We welcome you, sir.
Okay. Thank you, ma'am. We are going to discuss autism today. Please understand something very basic about autism before we discuss why this topic has come. So, I will start with a similar example that my eyes are genetically a little bad. So, when I was 40, the muscles stopped working properly, genetic. So, I started seeing blood, genetic, but I did not accept it. I used a specs, and now my quality of life has gone up. So, even though my eyes are still not good, I am getting on with life. Now, that is what we have to do with autism. So, that brings us to a very basic point. What is autism? Children are born apparently normal, but then begin to deteriorate by the age of 1 to 2 and almost always presents before 36 months of age. These children may have some speech developmental and social interactive regression. The word is regression, usually around 18 months of age. Now, इसका क्या मतलब हुआ? ये बच्चे नॉर्मल पैदा हुए, नॉर्मल ग्रो कर रहे थे, 1 साल, 1.5 साल, 2 साल हुआ, they have started saying papa, mama, dada, पानी, चावल, खाना, and then कुछ हो जाता है, ये स्लाइड करने लगते हैं पिछवाड़े की तरफ. They go back in time, they start losing the skills they had acquired. They can speak, they were speaking, but then they stopped speaking. They were mixing, but now they stopped mixing. They develop abnormal behavioral patterns, defective social communication, social interaction, and they go into their own world. ये है autism. Why does this happen? Now, it is still a theory, but we are coming close. There is a genetic predisposition causing susceptibility to environmental heavy metals and toxins with reduced capacity to excrete heavy metals so that they displace normal metals from the normal sites, and immunity abnormalities especially in the gut, which causes what we call a leaky gut. Now, what does this mean? These children have got some genetic defects with huge number of permutations and combinations possible. Two basic faults are developing. Their maturity for excreting unwanted substances is less than normal. So, about 60 to 90 children are normal. They get heavy metals, poisons, toxins, and they excrete it. But this one unfortunate individual out of 60 to 100 cannot do it properly. So, these toxins go on accumulating due to the genetic fault. These toxins irritate the brain, and so we have got a brain irritated child. Now, due to the same genetic or this toxin induced problems, the immunity is knocked out. Due to that, the whole gut is inflamed, so the permeability power of gut to selectively absorb only what we want, that is lost. So, when unwanted things enter the blood, necessary things are not entering the blood properly, their whole biochemistry changes. Due to this, we do not have a normal child anymore. Now, the child looks normal, can walk normally, but internally the whole biochemistry is disturbed. Because of that, these children are misbehaving.
सर, क्या ये डिसऑर्डर माइल्ड से सीवियर तक भी पहुंच सकता है?
ये सीवियर जो है पहुंच सकता है का मतलब है कि माइल्ड से शुरू होकर सीवियर चला गया, ऐसी बात नहीं है. कुछ बच्चे हैं जिनका जेनेटिक एबनॉर्मलिटी कम है, वो माइल्ड ही रह जाते हैं, थोड़ा सा अलग होते हैं, लेकिन वो नॉर्मल समाज में ही रह के, नॉर्मल स्कूल में ही रह के, नॉर्मल पढ़ाई लिखाई कर, लेकिन और बच्चों से थोड़ा हट के है, सबसे मिलता जुलता नहीं है, कंप्यूटर लेके ही बैठा रहता है, लोगों के साथ मिलकर खेलता नहीं है, ज़रूरत नहीं पड़े तो बातें नहीं बोलता है, लेकिन ज़रा सा जिसको कहते हैं हट के है, लेकिन फिर भी वो सारा चीज़ कर लेते हैं। जो मॉडरेट होते हैं वो भी जेनेटिकली प्री डिटर्मिन्ड है कि कितना जेनेटिक डिफेक्ट था, एकदम बचपन से 2-3 साल उम्र से अगर ठीक से उनका स्पेशल एजुकेशन, स्पीच थेरेपी, सेंसरी इंटीग्रेशन थेरेपी ये सब हो तो वो काफ़ी हद तक सुधर के नॉर्मल लाइफ में वापस आ जाते हैं। कुछ होते हैं जो मॉडरेट टू सीवियर होते हैं, उनमें हम लोग इतना ही कोशिश करते हैं कि वो घर परिवार में सुखी रह सके, घर परिवार उसको लेके सुखी हो। ये करने के लिए उसके अंदर में जो बायोकेमिकल प्रॉब्लम्स है उसको जहाँ तक सुधारना आजकल के ज़माने में संभव है, पॉसिबल है, वो हम लोग करते हैं।
I would like to request our viewers, if they have got any query related to our subject, that is diet and medication in ASD, they are free to call us at 26511 and our toll free number is 9800112008. You can also send us fax. Our fax number is 26511
एक और जो जेनेटिक डिफेक्ट जो अक्सर पाई जाती है, 2/3 बच्चों में एक एंजाइम है जिसको MTHFR, बहुत बड़ी नाम है, हमने छोटा नाम दिया है MTHFR, ये कम होता है या ठीक से काम नहीं करता है। सो दे हैव गॉट अ डिफेक्ट विच इज जेनेटिक in proper manufacture of an enzyme called MTHFR present in the liver. It is this enzyme which is necessary for the production of a form of vitamin B12 which we call methyl vitamin B12. Now methyl form is necessary for brain signaling, nerve activity and reducing the damage to the body by helping in the production of the body scavenger which we call glutathione. And why genetic? Well, lot of research has gone out all over the world. About 50 genes have been found out so far which contribute to this problem on chromosome 7, 3, 4 and 11. So we are closing in, but we are not close enough yet, and boys are affected 4 times more than girls. The normal incidence of having an autistic child is 0.2% only, but if one child is autistic, the risk of the second child being autistic is about 20 times or 10 times more, depending upon whether it is a boy or a girl. Girls are less affected, maybe because girls have estrogen hormone which is protective or some other genetic factor, we don't know. But boys 4 times more affected, risk of the second child is 10 to 20 times more than having the first child, which means we are dealing with a genetic problem. Remember my eyes, genetic problem doesn't mean we give up hope. We can improve quality of life. That is what we will discuss today.
Sir, you just said that 50 genes contribute to autism. So can you please explain the word gene?
Okay. Just like in a tape recorder or in a computer, we have a hard disk which has got all the data. Whenever we want to do something, we give the necessary command, then the head of the hard disk searches out that data, makes a copy into memory and hands it over to us to manipulate, to make a drawing or give a picture or the slideshow presentation which I am giving. In the same way, every cell in the body has got a hard disk which we call the nucleus. In that nucleus, we have about more than 24 genes. They are computer codes on a tape recorder tape-like chain, and each code is called a gene. One gene is responsible for the manufacture of one protein or one enzyme which will do something in the body. So when we say that there are 50 genes affected, it means that there are 50 proteins or enzymes which are either not manufactured at all or they are manufactured in a wrong way. And depending on how much gene a mother contributes, how much gene the father contributes, the child may have a small number to up to 50 genes which may be wrong. So we have this wide spectrum of mild to severe case. So the genetic code is how we are made up, how we are built up. That is determined. So that is called gene.
कोई डेफिनेट फैक्टर्स अभी तक आइडेंटिफाई नहीं हो पाए हैं कि व्हाट आर द कॉजेस ऑफ ऑटिज्म. लेट्स टॉक टू डॉक्टर अरुण दैट व्हाट ही एक्सप्लेन्स.
So we always say do not marry in the family. Why? Because no human being is perfect, only God is perfect. We all have defects, but the defect of the mother's gene is covered by the strong father's gene. Defects of the father's gene is covered by a strong mother's gene. So when two dissimilar people have a child, they knock out each other's defective genes and the child is born normal. But if both the parents are carrying the same defect at the same place, then that defect passes on to the child, which is a very, very simplistic way of saying what is a genetic disease. Genetic disease is something that all of us have, that I have got a genetic defect of the eye. There are people who will have diabetes, somebody will have hypertension, somebody will have asthma. So we live with a number of genetic diseases in our day-to-day life, but that doesn't bog us down. We control diabetes, we control blood pressure, we control asthma, we control the power of the eyes, we get on with life. That is what we have to do with autism. It is a genetic defect triggered by environmental pollutions. So when the two come together, the child starts regressing and becomes autistic. If we can remove the gene caused problems in the body, we give a better quality of life to the child is less irritated, can concentrate on what needs to be done, and most of these children have normal to above normal intelligence, they can get on with their life.
So some parents consider themselves responsible for this disease of their child. Is it so, sir?
Look, it is yes and no. It is not the parental upbringing of the child which is responsible for genes. It is not the socio-economic status of the parent. It is not the behavior of the parents. This is a genetic abnormality passed on by the union of the father's gene and the mother's gene. This is a genetic mediator. To that extent, both parents are responsible. Because if the mother has a genetic defect, it is the father's duty to correct it. If the father has a genetic defect, it is the mother's duty to correct it. When both of them fail to do it, then the child has got a problem. So this autism problem is a cumulative genetic defect of both the parents. And it has nothing to do with the social level, social upbringing, friend circle, behavior with the child, education level. No, it affects anybody and everybody. So parents are directly not to blame except for genes over which they have got no control. So can we go ahead?
Yes, sir.
Now this slide just shows that on the one hand we have got genetic susceptibilities, on the other hand we have got environmental insults in the form of heavy metals which can come from pollution or vaccines, heavy viral antigen loads, heavy metals from other sources like food, water chain, severe childhood infections, and all of them contribute to this chart, which I would like to be shown for a little while, because those genetic defects cause decreased immune response, so we can control it. Poor nutrition, vitamin, mineral deficiencies, we can control it. Leaky gut syndrome due to gut inflammation, we can control it. Candida albicans and E-Tech infection of the gut, we can control it. Impaired detoxification of heavy metals and their toxicity, we can control it. Impaired antioxidation, we can control it. Low fatty acids, proper diet. Impaired pancreatic function, we can control it. So most of the defects of the genes are today manageable by proper diagnosis, proper treatment, proper dosage as per the age of the child, the weight of the child and the nutrition of the child, which basically comes down that if we have a healthy body, we have a healthy mind.
कई बार कॉम्बिनेशन ऑफ सिम्टम्स प्रेजेंट होने के कारण जो ट्रीटमेंट होता है उसके रिजल्ट में कुछ प्रॉब्लम्स आ जाते हैं, तो हम पूछेंगे डॉक्टर साहब से कि फॉर बेटर रिजल्ट्स आफ्टर द ट्रीटमेंट व्हाट वी हैव टू डू.
जैसे मैंने शुरू में कहा कि ऑटिज्म क्योरेबल नहीं है, मैनेजेबल है. जिस तरह से डायबिटिक, ब्लड प्रेशर, एज्मा मैनेजेबल है, ये भी कुछ हद तक, पूरा नहीं, मैनेजेबल है. क्या ये बच्चे नॉर्मल हो जाएंगे? जी नहीं. ऑटिज्म है, ऑटिज्म रहेगा, लेकिन स्टैंडर्ड थेरेपी जो कि फाउंडेशन है, सबसे ज़रूरी है, स्टैंडर्ड थेरेपी होना है. और नीड बेस्ड जो प्रॉब्लम हमें मेडिकली दिखाई दे रही है, जिसका ड्रग कंट्रोलर अप्रूव्ड दवाई अवेलेबल है देश में, उसके सहारे हम इन बच्चों का क्वालिटी ऑफ लाइफ काफ़ी सुधार सकते हैं, जिसके बारे में हम एक एक करके चर्चा करके हम समझाना चाहेंगे कि ये कैसे करते हैं. सबसे पहले बात है कि जितना जल्दी हम शुरू करें उतना अच्छा रिजल्ट मिलेगा. क्योंकि जैसे एक बच्चे का ब्रेन सिर्फ 300 ग्राम की होती है, लेकिन सिर्फ 3 साल उम्र में उसका ब्रेन 1100 ग्राम और हमारा आपका ब्रेन सिर्फ 1300 ग्राम. यानी कि बच्चे का जो ब्रेन बनना था वो 3 साल में ही बन जाता है. उसके बाद उसका जो कनेक्शंस है वो अगले 1-2 साल में हो जाता है. यानी कि मेजॉरिटी ऑफ ब्रेन डेवलपमेंट 5 साल के अंदर होता है. ऑटिज्म को हम लोग पहचान सकते हैं दूसरे या तीसरे साल में ही. उसी समय से अगर स्टैंडर्ड थेरेपी इंटेंसली शुरू किया जाए, वो हफ्ते में कोई एक दिन आके हाथ पैर हिला दिया वो ट्रीटमेंट नहीं है. ऑटिज्म का स्टैंडर्ड थेरेपी हर रोज होना है. माँ को और पिताजी को समझना है कि क्या करना है, घर में कैसे बर्ताव करना है, जिसके कई होम प्रोग्राम्स हैं. जैसे दिल्ली शहर में AFA बहुत अच्छी प्रोग्राम करती है. हर शहर में इस तरह से संस्थाएं हैं जो कि पेरेंट्स को सिखाते हैं कि इन बच्चों के साथ कैसे बर्ताव करें, कैसे धीरज रख के उनको संभालें. दैट इज स्टैंडर्ड थेरेपी. उसके साथ स्पेशलाइज्ड ऑक्यूपेशन थेरेपी, जिसको सेंसरी इंटीग्रेशन बोलते हैं, स्पेशलाइज्ड स्पीच थेरेपी, ये सब करके बच्चे में काफ़ी सुधार आता है. और मेडिकली हम लोग उसको पूरा चेक करके उसको जहाँ तक हो सके हर मामले में उसका न्यूट्रिशन, उसका डाइट, उसके एलर्जी, उसके इन्फेक्शन कंट्रोल, ये सब करके जहाँ तक नॉर्मल करने का कोशिश करते. लेकिन सवाल आप ये पूछेंगे हम कैसे समझेंगे, तो हम आपको सुनाते हैं. 12 महीने के अंदर में बच्चा अगर बैबलिंग या जेस्चरिंग नहीं करे तो कुछ गड़बड़ है. जैसे 12 साल का बच्चा भले ही बोल नहीं पाए लेकिन इशारा करके बोलेगा कि हमको वो चाहिए. 16 महीने तक कम से कम एक वर्ड बोलना चाहिए. माँ, पा, ये सब वर्ड नहीं है. वो तो गाय भी माँ बोलती है. चाचा, भैया, पानी, वाटर, फूड, टॉय, ये सब वर्ड हुए. 24 मंथ्स में 2 वर्ड्स आने हैं. अगर 2 वर्ड्स नहीं आए, प्लीज पड़ोसी की, चाची के, मौसी को मत सुनिए कि नहीं नहीं लड़का है देरी से बोलेगा. प्लीज शो टू अ प्रॉपर ऑटिज्म ट्रेन्ड थेरेपिस्ट, स्पेशली अ साइकोलॉजिस्ट, कि मेरा बच्चा 2 साल हो गया, माई चाइल्ड इज 2 years old एंड नॉट टॉकिंग 2 words. What is wrong? Please evaluate. Don't leave it to chance. Yes, many children talk after 2-3 years. I agree. But don't take a chance. If the child is autistic, the first 5 years of life are critical. Every day is important. Please do not neglect. This is how you recognize. By 12 months, gesturing, 16 months, 1 word, 24 months, 2 word must come.
Sir, is it true that sometimes even healthcare professionals cannot diagnose the disease autism in the child?
Absolutely 100% correct. You see, even in our MBBS and MD courses, autism is one small paragraph. The only person competent to diagnose is a psychologist or a psychiatrist using the DSM-4 criteria. We can suspect, we are not legally authorized to diagnose a child as autistic. Only a psychologist or psychiatrist should diagnose using proper DSM-4 criteria. Then the therapists come into the picture to decide what standard therapy to give, what special education, what speech, what sensory integration, etc. The doctors are coming in step number 3, doing a complete biochemical profiling, finding out what vitamin, what mineral, which protein, what are the allergens, how to control the diet, how much to proteins to give, so that the child is physically in top grade health. That is where the doctor comes in. Any medication required, psychiatrist, not a doctor. We are not authorized to give psychiatric drugs to an autistic child, even though I am a doctorate in medicine. I am not authorized. Psychiatrist will give that. So any drugs, psychiatrist. We are authorized as an MBBS doctor to give proper nutrition, vitamins, minerals, proper diet, avoid infections, guidelines. Therapist will give standard therapy. That is the foundation. But the diagnosis must come from a psychologist or psychiatrist if the child does not have 2-word sentence by the age of 24 months. The management plan, as you can see, is 3-pronged. Right on top is standard therapy, that is sensory education, special education and speech. Then we have psychiatrist treatment of atomoxetine, methylphenidate and whatnot, and the counseling. And the biomedical aspect where we are concerned, including a nuclear scan based hyperbaric oxygen, which we will discuss later on. Now, what is it that we are trying to do with all this treatment? We are only trying to improve the quality of life of the child so that the child can come back to society, so that the parents find it easier, the child can attend school and keep up with the peers, enjoy the games, be a lively young child, enjoy life and go on to a fruitful, educative and self-employed life. Which means first we reduce hyperactivity, then the child can concentrate more and learn more. We reduce attention deficit, then he will remember more. We reduce impaired communication and psychosocial skills, then he becomes part of society. We reduce leaky gut syndrome medically, then he absorbs proper nutrition, avoids toxic materials and grows up to be a healthy individual. And wherever there is an actual any other defect like brain inflammation, etc., we do a SPECT scan, we identify that there is an inflamed lesion in the brain, then and then only hyperbaric oxygen therapy has a role to play. So there now we come to the main topic of the day, what diet and medications. Any questions so far?
Sir, even parents and caregivers, I think they should also be careful for these kind of children. Like especially speech should be watched carefully every year.
Yes.
Is it so, sir?
Absolutely. Because these children develop speech and then they regress. So if the child has learned to speak and by the 2nd, 3rd year stops speaking, now that's the abnormality.
डॉक्टर साहब ने बताया कि ऐसा ज़रूरी नहीं कि जो सिम्टम एक बच्चा दिखा रहा है ऑटिज्म का वही सिम्टम्स सिमिलर सिम्टम्स दूसरे बच्चे में भी हो, और कई बार तो ऐसा भी हो जाता है कि कॉम्बिनेशन ऑफ सिम्टम्स एक ही बच्चे में मौजूद होते हैं. चर्चा अभी जारी रहेगी, लेकिन अभी समय है एक छोटे से ब्रेक का.
The chief handicap of the blindness is not blindness, but the attitude of seeing people towards them. आइए जानने और समझने की कोशिश करते हैं कि बधिरांधता यानी डेफ ब्लाइंडनेस क्या है. बधिरांधता एक स्थिति है जिसमें दृष्टिहीनता एवं सुनने की शक्ति में कमी आती है तथा जिससे विचारों के आदान प्रदान और रोजमर्रा की आवश्यक